Hi everyone, I appreciate you watching this Zoom presentation. My name is Evan Gurney. I'm an MD MPH candidate for the class of 2022, currently working with the Campus Health Center for my Master of Public Health practicum. This presentation is about alcohol, especially during this COVID-19 pandemic. So what are we going to cover today? Well, my goal is to give you a broad overview of everything an undergraduate student at Wayne State University needs to know about alcohol. First, we'll start by talking about relevant statistics and about alcohol itself. Then we'll touch on hangovers, blackouts, and withdrawal, and then move on to discuss alcohol poisoning, medical amnesty, and legal problems that can occur because of alcohol. Next, I'll talk about how alcohol impacts both mental and physical health, then how you can drink safely. Next, I'll discuss how intimate partner violence and sexual assault relate to alcohol. Then alcohol, stress, and COVID-19. Finally, I'll wrap up with alcohol use disorder and the alcohol-related resources that are available to you through the university as Wayne State students in Detroit and national resources. So why does this matter? Well, alcohol is a part of campus culture. In a national survey, 55% of college students said that they've drank in the past month, and 35% say that they've binge drank, and I'll define binge drinking on the next slide. And 10% reported heavy drinking, which is binge drinking on 5 or more days in the past month. And I also want to point out to you that there's these numbers in the top right-hand corner of the slide, and these correspond to my sources that are listed at the end of the PowerPoint. So if there's anything that you want more information on, you want to do a little research on your own about, you can find the source that matches the number and use the link provided. So binge drinking in college. I already mentioned that over 1/3 of college students endorsed binge drinking, so what is it? Binge drinking is where someone drinks to where their blood alcohol concentration, or BAC, is at or above 0.08. This equates to 0.08 grams of alcohol per 100 milliliters of blood. This usually happens when a woman drinks 4 drinks within 2 hours, or a man drinks 5 drinks within 2 hours. So why does this matter during COVID-19? Well, the American Heart Association reported that alcohol sales are up, and people say that they're drinking more during the pandemic. And could drinking alcohol during COVID-19 be dangerous? We're going to talk about this later. What is alcohol? Alcohol is actually this chemical compound right here called ethyl alcohol, or ethanol. And don't worry, if you were scarred by chemistry like I was during undergrad, this is the only mention of it during this presentation. So alcohol is a toxin and a depressant. What does this mean? Well, a toxin means that the body wants to get rid of it as soon as possible. And it's a depressant because it messes with a lot of the neurotransmitters or chemicals in the brain. It increases dopamine and serotonin, which are the brain's feel-good chemicals. It also causes GABA to be released, which is the brain's slow-down chemical. And it suppresses glutamate, which is the brain's speed-up chemical. So all these things overall, it means alcohol makes you feel good and relaxed, at least at first. Alcohol gets absorbed into the body through the stomach and the small intestine. If you drink a higher proof or percentage of alcohol, it gets into your system faster. Drinking on an empty stomach also causes alcohol to be absorbed faster than drinking after or with food. Alcohol is distributed throughout the entire body through the blood. It goes quickly to the brain and the lungs because those organs have a lot of blood vessels. And remember a few slides ago, I said that to get to a BAC of 0.08, women didn't have to drink as much as men. Well, that's because women typically have more fat and less blood volume than men because of the way women's bodies are composed. So because of this, women usually get to a higher BAC with less alcohol than men. Now, metabolism. Metabolism is just a fancy word for breaking down. 90% of alcohol is broken down by the liver. The chemical compound of alcohol can't leave the body as it is. It has to be broken down by enzymes in the liver before the body can get rid of it. The enzyme is called alcohol dehydrogenase. Variations in alcohol dehydrogenase are why people react differently to alcohol. Men usually have more of it than women, contributing to why men can usually drink more. And there's a variation that most commonly occurs in East Asian people, which is why some experience alcohol flush. So, hangovers. Hangovers happen from drinking an excessive amount of alcohol, or simply stated, you drink too much. The symptoms commonly experienced are feeling tired, weakness, being thirsty, headaches, feeling sick to your stomach, anxiety, sweating, and your heart rate and blood pressure can actually be higher than what they normally are. So, what causes these symptoms? Well, first, dehydration. Alcohol suppresses this hormone in your brain called vasopressin, and vasopressin causes you to pee more and lose fluids. Alcohol also messes with sleep. It causes you to have a more fragmented sleep and wake up earlier. You just don't get a good night's sleep after drinking a lot, which is contrary to the myth that I know I've heard before, that alcohol before bed helps you sleep. You might fall asleep easier, but your quality of sleep is going to be worse. Now, gastrointestinal irritation or stomach upset. Alcohol irritates the lining of the stomach. It causes more acid to be released, which leads to nausea and discomfort. Alcohol also causes inflammation throughout the body, which leads to malaise. And malaise is that achy, awful feeling all over when you're getting the flu. That's malaise. Mini withdrawal. Withdrawal, that sounds kind of serious, right? Well, all those good feelings that we talked about because the brain is releasing those feel-good chemicals, well, when those are released, the brain adjusts to try to keep the balance. So when alcohol wears off, you feel more restless and anxious until the brain can get those levels back to normal. So hangover symptoms peak when the BAC returns to 0, and your symptoms can last for 24 hours or longer. Now I have some hangover questions for you all. The first is, does drinking coffee or taking a shower prevent a hangover? No. The only thing that prevents a hangover is not drinking at all or drinking less. Does the order of drinks matter? Maybe you've heard the phrase before, liquor before beer in the clear, beer before liquor, never sicker. No. The more alcohol you drink, the worse your hangover will be, whatever the order you drink them in. However, there are some things added to certain types of alcohol that can potentially affect your hangover. For example, congeners from fermentation are in dark liquor and can cause worse hangovers. And sulfites are added to wine and they can cause worse headaches. Are there hangover cures? No. Only time can cure a hangover. The body needs time to get rid of the toxins, rehydrate, and heal the irritated tissue. Helping with rehydration by drinking water or Gatorade is important, but it's not going to cure your hangover. And finally, does taking over-the-counter pain relievers before bed help? No, and it can actually be dangerous. Ibuprofen or Advil and aspirin increase stomach acid and can put you at risk of stomach ulcers. Remember I said that alcohol itself also releases stomach acid. So that's why putting them together is dangerous. And then acetaminophen or Tylenol in combination with alcohol can be toxic to the liver because they both have to get broken down in the liver. So avoid these medications when you're drinking. Now we're going to move on and talk about blackouts. Blackouts are episodes of amnesia or periods that you don't remember. They can either be en bloc, where you don't remember anything at all and you're not going to be able to get any of that memory back, or fragmentary, where you remember bits and pieces and some memory might come back if someone jogs your memory. For example, if you're at a party, you black out, but the next day your friend's like, oh my God, you did this really embarrassing thing last night. And then you're like, all of a sudden, you remember that really embarrassing thing you did last night. That'd be a fragmentary blackout. So this happens because of a rapid rise in your BAC. It's most likely to happen if you're drinking quickly on an empty stomach. And 51% of college students say that they've blacked out before, so it's unfortunately pretty common. The reason you're not remembering anything is because alcohol interferes down here with taking your memory from short-term to long-term memory. That's why you're able to hold up a conversation when you're blacked out, because your short-term memory is working just fine. But this transferring coding piece that takes it from short-term to long-term memory stops working. There's a lot of neuroscience behind this, so if you're interested in that, I encourage you to check out this source and read more about it. Alcohol withdrawal. So alcohol withdrawal happens when a person who is dependent on alcohol suddenly stops drinking or greatly reduces the amount that they drink. Potential symptoms are rapid heart rate, elevated blood pressure, sweating, shaking or tremor, anxiety, anhedonia, or being unable to find pleasure in activities that you normally would, or motor seizures. The most severe form of alcohol withdrawal is called delirium tremens, sometimes associated with hallucinations. It usually happens within 12 to 48 hours after drinking has stopped. It occurs most often in people who have been drinking for more than 10 years. Delirium tremens is life-threatening and requires a hospital stay for treatment. Symptoms are sudden severe confusion, body tremors, changes in mental function, agitation, and irritability. If you suspect someone is going through alcohol withdrawal or delirium tremens, call 911 and get them emergency medical services. Alcohol poisoning. Alcohol poisoning is also called alcohol overdose. The risks of alcohol overdose are binge drinking, drinking very quickly, drinking on an empty stomach, and certain medications you could be taking, like opioids or sedative hypnotics, which are certain sleep and anti-anxiety medications. The process is that your BAC is rising, then you black out, then you become unconscious, and then you overdose. Because your BAC is continuing to rise even after you finish drinking or you fall asleep or pass out. Remember that during blackouts, the part of your brain that controls short-term going to long-term memory stops working. And when an alcohol overdose happens, more parts of the brain begin shutting down. And eventually, if your BAC gets high enough, the brainstem can shut down. The brainstem is what keeps us breathing and keeps our hearts beating. So when this shuts down, it's a medical emergency. Signs and symptoms of alcohol overdose are confusion, vomiting, seizures, slow or irregular breathing, slow heart rate, clammy skin, low body temperature, blue or pale skin. If you suspect alcohol poisoning, call 911 or the Wayne State Police if you're on campus, because it is a medical emergency and that person could die without treatment. So after you call the police, don't leave them alone. Have them sitting or partially sitting, and if they're unconscious, roll them onto their side so that if they throw up, they won't choke on their vomit. Because another thing that the brainstem controls is the gag reflex. So medical amnesty. In 2012, the state of Michigan passed a medical amnesty law. They passed this because people under the age of 21 would not call 911 for alcohol poisoning because they were afraid of getting in trouble for underage drinking, and people were dying because of this. So now, if you're under 21 years old and drinking, you can go to a medical or treatment facility if you or a friend needs medical attention, or if you are seeking treatment after a sexual assault without getting an MIP or minor in possession. You can also call for emergency medical services without getting in trouble for underage drinking. And this bottom bullet point here is a Wayne State policy. You will not get in trouble from the university for using alcohol or drugs if you're reporting a sexual assault or sexual misconduct. But it's very important to be respectful to the emergency medical services. Don't get in their way or prevent them from doing their jobs, or that you may still get in trouble for underage drinking. And this also does not exempt you from possession of drugs if you have more than personal use. So call for help, dump your drugs. You can't buy another friend, so make sure that you get them help. And this also does not count if the police find a drunk person and take them to a hospital. If you trip and fall in the street and get hurt and the police find you and take you to the hospital, you can still get an MIP. It has to be either you or a person you're with initiating the help for treatment. And so the takeaway from this slide is that if you're on campus, call the Wayne State Police. If you're off campus, call 911 for help. You're not going to get in trouble. Getting your friend help is the most important thing, or getting yourself help. So over the next few slides, I'm going to discuss the different negative consequences that can happen because of alcohol and drinking. First, we're going to discuss legal problems. If you're under 21 years old and you get caught drinking, you can get an MIP, or minor in possession. The first time is a civil infraction with a fine of up to $100, substance abuse screening that you have to pay for, and community service. The second time you get an MIP, it's a misdemeanor with a fine up to $200, again, substance abuse screening you have to pay for, community service, plus potential license suspension or jail if probation was violated. If you're over 21, the legal BAC limit in Michigan is 0.08. However, if you're under 21 and you're caught driving with any BAC above 0, the first time you'll have a restricted license, 4 points on your driving record, a fine of up to $250, and $500 driver responsibility payment for 2 years. The second time results in license suspension, a fine up to $500, along with the $500 driver responsibility payment for 2 years, and potentially jail time. So not only is driving under the influence extremely dangerous, it's also very expensive, so don't do it. So other laws in Michigan and Wayne State policies. So Michigan law basically says that public intoxication, if you're endangering the safety of anyone or property, or you're causing a public disturbance, that's illegal. It also says that you cannot carry, possess, or use a firearm if you're under the influence of alcohol or a controlled substance. And then here's some Wayne State policies stating that the unlawful possession, use, distribution, dispensation, sale, or manufacture of drugs or alcohol is prohibited on university premises, at university activities, and at university work sites. Again, the use or possession of alcoholic beverages is expressly prohibited in classrooms, lecture halls, laboratories, the libraries, the chapel, and within buildings or arenas where athletic events, lectures, or concerts are held. And the Wayne State Community Living Guide restricts possession, use, and distribution of alcohol in student housing to those over the age of 21. If you're over 21 and you're buying alcohol for a minor, you can also be liable if anything happens to that minor. And potential sanctions if you violate Wayne State policies range from reprimand to expulsion. Alcohol can impact your academics because alcohol worsens your memory, planning, learning, and cognitive function. 1 in 4 college students say that they've had academic consequences from their drinking. This includes missing a class, falling behind, and doing poorly on papers or exams. And college students who binge drink 3 times per week were 6 times more likely to do badly on a test and 5 times more likely to miss a class compared to their peers who didn't binge drink. Alcohol can also affect your mental health. It worsens anxiety and mood disorders and can make them more difficult to treat. Alcohol can also cause depression and anxiety itself. And during the hangover period, the mini withdrawal that I talked about earlier can produce anxiety symptoms until the brain regains its balance from before drinking. Alcohol also affects several aspects of our physical health. It can cause injuries from falls, car accidents, or burns from unsafe behaviors while drinking. Lowered inhibitions from alcohol can also increase the likelihood that someone's going to engage in risky sexual behaviors, like unprotected sex. This leads to an increased risk of sexually transmitted infections and unplanned pregnancies. Long-term health consequences of drinking are high blood pressure, heart disease, and liver disease. And the liver diseases include alcoholic fatty liver disease, acute alcohol hepatitis, and cirrhosis, which is scarring of the liver, and that leads to liver failure and eventually liver cancer. Breast and colon cancer are also associated with drinking. And this little diagram over here shows a lot of the different health effects all over the body. It's pretty cool. So I talked about all these bad things that can happen while you're drinking, and you're going to drink anyway. So now what? So we need to talk about how you can drink safely. There's no way to be 100% safe when you're drinking, but we can make sure that you're drinking safer. The first step to that is knowing how much you're drinking. On the next slide, I'm going to talk about how the number of drinks affects your BAC, but in order for that to mean anything to you, we need to talk about what a drink really is. So how much a standard drink is depends on the percentage or proof of it. So 5% alcohol is usually beer. And for beer or 5% alcohol, a standard drink is 12 ounces. And for 12% alcohol, which is like wine, a standard drink is 5 ounces. And for liquor, 80 proof or 40% alcohol, a standard drink is 1.5 ounces. And here on these solo cups, they give you approximate measures of how much a drink is. So like the bottom line here, 1 ounce, that's your liquor. The next line is about 5 ounces, so wine, and the top line is about 12 ounces, which is your beer. But you need to remember that just because it's like 1 cup doesn't mean it's just 1 drink. If you're pouring liquor into a solo cup and you're going way over that bottom line, yeah, it may just be 1 cup, but you're actually drinking multiple standard drinks. Same with beer. If you're drinking a 40, just because it's a low percentage, that doesn't mean it's 1 drink. A 40 is actually over 3 drinks because it's 40 ounces. So you really need to know how much you're drinking, and you need to know your limits when you're drinking. So the slide is really busy, but it has a lot of really great information on it, so I'm going to break it down. On either side here are the BAC charts, on the left for women, on the right for men. And I'm going to give you, we're going to talk about how to read these charts, and I'm going to do this by giving you a scenario. So let's say we're a 180-pound man. So we're going to come over here to men, 180 pounds. We drank 3 drinks and then waited 1 hour. So we're going to follow this chart, 180, and then we're going to go down 3. I think my mouse comes back. So 3. So now our BAC is 0.04. We wait another hour, so it's been 2 total hours since we drank. So we come down here, 2 hours after drinking. We're 180 pounds. We drank 3 drinks. We waited 2 hours. Now our BAC is 0.03. So here's another scenario. We're still that 180-pound man, but we drank 6 drinks and waited an hour. So come back up here. We go down 6. Now our BAC is 0.11. So we wait. So that's very intoxicated. That's well over the legal limit if you're over 21. So we wait another hour. It's been 2 hours since we drank our 6 drinks. We come down here. Now our BAC is 0.09, which is still above the legal limit and still pretty intoxicated. So as you can see, your BAC goes down pretty slowly. And now if we focus on the diagram in the middle, we can see in the first scenario where our BAC was 0.04, we're down here in this mild impairment category. This is where the perceived benefits of alcohol happen, like where you feel good, you feel relaxed, and you're more social. In the second scenario where your BAC was 0.11, we're up here in this increased impairment category. This is where you start to lose the benefits of alcohol and you just become more drunk. You can't drive and you're at an increased risk of injury, and you can begin to black out. And you definitely want to avoid the severe impairment and the life-threatening categories where your BAC is at 0.16 and higher, because this is where you're reaching alcohol overdose levels and all the dangers that come with that. I can assume that you all drink for the perceived benefits that come with it. Feeling good, feeling relaxed, being more social. Well, all of these things happen down here in this mild impairment and the low end of this increased impairment categories at about BACs of 0.07 and lower. Once your BAC gets higher than that, you're not getting any more of these benefits. So if you're going to drink, look at where you are on these charts, find your little spot, and look at how many drinks you can have to stay in these yellow and green areas, because that's where all the benefits happen. And once you start getting into the red areas, you're not getting any more benefits and you're getting more risk for the bad things that can happen from drinking. So just try to keep your BAC at a manageable level. Now, the next important step for being safe while you're drinking is to have a plan. You're going out to a party, you're just going out to a bar, whatever you're going to do, have a plan. Never drive after drinking. That's the most important thing. It's extremely dangerous. As we saw earlier, it's very expensive. Don't do it. And now that there's Uber and Lyft, there's really no excuse. Have the apps on your phone. Know if you're going to Uber or Lyft from the party or the bar. And I know on Uber, at least, you can split the fare, so it's pretty easy. And if you don't want to use the apps, plan for a designated driver, but only if that person is not drinking at all. And then if you don't have any other options, stay where you are until you're sober. Sleep at a friend's house. Sleep on their couch. Sleep on their floor. Just do whatever you have to do to avoid driving until you're sober. Now we're going to shift and talk about alcohol and intimate partner violence, or IPV. IPV is any behavior in an intimate relationship that causes physical, psychological, or sexual harm. Victims believed their partner had been drinking prior to a physical assault in over half of cases. In perpetrators, heavier, more frequent drinking increases the risk of violence and was more likely to result in injury of the victim if the perpetrator had consumed alcohol prior. Other factors that contribute are mental health and beliefs about gender roles and violence. Usually, more traditional beliefs about gender roles are associated with violence. It's important to remember, though, that alcohol doesn't make someone an abuser. It may lower their inhibitions, or they may use drinking as a way to justify their abuse, but alcohol is not the cause. And if you're a victim of IPV, it's not your fault. If you'd like to learn more about IPV, the Campus Health Center has a presentation about it called Love Shouldn't Hurt, which is on their website under Outreach and then Health Programs, and I encourage you all to check it out. And if you'd like resources about IPV, you can go to this website right here, warriorlife.wayne.edu/relationships, or scan this QR code. And it's going to take you to a list of resources. Now, alcohol-facilitated sexual assault. I know that when people think of drug-facilitated sexual assault, you're going to think of like roofies or GHB or whatever other stuff they show on Law & Order SVU, but actually, alcohol is the most common substance used to perpetrate drug-facilitated sexual assault. There's also this widespread myth of a stranger in the bushes or a white van. They're in a trench coat, they're in a dark alleyway, and they snatch a stranger off the street. But in all actuality, victims know the perpetrator in about 80% of sexual assaults. So what does alcohol-facilitated sexual assault look like? It can be being pressured to drink more than you're comfortable with, or asking for help after drinking too much and being ignored, or even not being told what's in your drink after asking. Why do perpetrators use alcohol? Well, first, alcohol is just way easier to get than a drug. You can buy alcohol at a grocery store. You can't buy GHB at a grocery store. And alcohol lowers inhibitions, and like with IPV, it can be used to justify actions. Alcohol also makes it more difficult for the victim to resist, and it can also prevent the victim from remembering the details, making them not want to report or making it more difficult for them to report. A big reason why people don't report is because of fear of not being believed, and if you don't remember everything that happened, you might worry that you're not going to be believed more. So what can you do about this? Well, first, don't leave your friends. Make sure that they get home okay. Never leave your drink unattended, and watch your drink being made. If someone slips a drug into your drink, it can be almost impossible to know that your drink was tampered with because these drugs can be tasteless, colorless, and odorless. Earlier, I said that knowing your limits was important. If you can normally have 3 drinks before you feel drunk, and you had 1 drink and you're just disproportionately messed up, you may have been drugged and you should seek medical attention. And know your friend's limits for this same reason. If your best friend can normally have 4 drinks and they had 1 beer and they're acting ridiculously drunk and they don't seem okay, you want to get them medical attention. And if you see something suspicious, intervene. You see someone who's cornered or looks uncomfortable, go up to them and pretend them that they're a friend you haven't seen in a while. Hey girl, it's been forever. How are you doing? Or, hey, aren't you in my math class? What about that homework assignment? If that person wants out of the situation, they're going to gladly take the out that you just gave them. And if not, you might feel awkward for 10 seconds and then you're going to move along with your night. And men, call out other men. Bro, that's creepy. Bro, she's too drunk. Bro, don't do that. And remember medical amnesty. Call 911 or the campus police if you need them. And don't let underage drinking stop you from seeking treatment after a sexual assault. You will not get an MIP and you will not get in trouble with the university. And I also just want to say that you can do everything right and still be assaulted. You can always have a buddy. You can always watch your drink. You can always do X, Y, and Z. And this is because perpetrators are usually someone that the victim knows, and they take advantage of trust and your guard being down. You don't have pepper spray ready when you're studying with your pal from biology or your good friend invited you to a party. And the most important takeaway from the slide is that if you were sexually assaulted after drinking or sexually assaulted ever, it's not your fault. The blame is always solely on the perpetrator who chose to hurt you. And now the sexual assault resources. First, there's the Wayne State University Counseling and Psychological Services, or CAPS. Here's their location information and their phone number. And then here's the Title IX website and the Title IX director's information. On the Title IX website, there is information about reporting on campus, which is different and separate from the legal process. They may work together for the investigation sometimes, but the process, the amount of evidence needed, and the punishments are different than in the legal process. There's also information about the investigation process on this website. And then here's Wayne County Safe. It's an organization that provides free sexual assault services to everyone, includes a free forensic medical exam within 120 hours or 5 days after an assault, and they also provide counseling and advocacy services. And even if you don't want to report, which is valid, you should still receive medical care because they can provide you with medication to prevent STIs, Plan B to prevent unwanted pregnancy, and they can even give medication to prevent HIV. So listed here is the Title IX process. First, when Title IX gets a report of potential policy violation, they reach out to an individual to provide information and confidentially discuss support measures and resources. They're going to ensure the individual's safety and well-being, and then they make sure the individual is aware of their rights and options for filing a complaint with the university and/or law enforcement. The Title IX team will work with the person who filed the report to coordinate supportive measures, including counseling services, mutual no-contact orders between involved parties, modification of on-campus housing or employment to ensure their safety, academic assistance, and safety planning assistance. And these measures are available whether or not the individual decides to submit a formal complaint. The Title IX office is there to keep students safe, and that's their top priority. So how does alcohol relate to stress and COVID-19? Well, people sometimes turn to alcohol during times of stress. A study showed that both men and women who said they experienced more stress also drank more. But men tended to use alcohol to deal with stress more than women. As we talked about earlier, the chemicals in the brain that are released when you drink can lead to good feelings and relaxation at first, but in the long run, this can have negative consequences, like all the stuff we talked about before. And COVID-19 is causing more stress. I probably don't need to tell you that. You probably know. There's fear and anxiety about the disease. There's social isolation, online education, and a loss of routine. It's normal to feel all these things during a pandemic, to feel overwhelmed, to feel stressed. But it's even more important during these times that we try to deal with our stress in healthy ways. If you find yourself turning to alcohol during times of stress, try to find healthy alternatives. First, it is really important for you to take care of your mental health, especially during this time. I'm a big advocate for therapy. I think that everyone should go to therapy if you're able to. And personally, especially with online classes, it can be difficult to find time for yourself. So make sure to schedule time for breaks and things that you enjoy. Personally, I build breaks and things that I enjoy, like watching MSU sports, Go Green, and walking my dog. I put those into my schedule so that I don't have to find time to do those things. They're already built in, and I don't have to feel guilty for doing that. And you need to take care of your physical health. Try to eat healthy, well-balanced meals. Get enough sleep and move your body in whatever ways that you enjoy, like walks, yoga, sports. Deep breathing and meditation can also be relaxing and helpful. Spend virtual time with family, friends in the Wayne State community. Try to stay involved and engaged. There are also programs on the Campus Health Center website that can give you more information and better ideas about dealing with stress. There's one called Mindfulness Techniques, and there's another called Stress and Anxiety, and I definitely recommend you check them out when you have the time. Here is a self-care wheel, and it just has different ways, ideas and ways to take care of different aspects of yourself. But really just try to find and prioritize things that make you happy and bring you joy. And don't be afraid to reach out and ask for help, whether that be from friends, family, or a professional. It's okay to ask for help. So drinking alcohol, it's even more important to talk about during the pandemic because alcohol weakens your immune system, which makes you more susceptible to COVID-19 infection and other infections like the flu. We're now in flu season. On top of that, alcohol lowers your judgment and your decision-making abilities, making you less likely to follow CDC guidelines and like wearing masks and social distancing. And as our numbers continue to rise during the winter, it's really important that we continue to follow these guidelines. Here's some information from the World Health Organization, some myths and facts, so let's talk about this for a second. So the first myth is that consuming alcohol destroys the virus that causes COVID-19. And the fact is that consuming alcohol does not destroy the virus. Alcohol is at least 60% volume in hand sanitizer. It does disinfect your skin, but it does not have the same effect when you drink it. The next myth, drinking strong alcohol kills the virus in the inhaled air. And the fact is that consumption of alcohol does not kill the virus in the inhaled air. It doesn't disinfect your mouth or your throat, and it does not protect you. And the last myth is that alcohol stimulates immunity and resistance to the virus. And we already talked about this. Alcohol actually weakens your immune system and makes you more susceptible to getting COVID-19. So now we're going to shift and talk about alcohol use disorder. So this is a disorder that's listed in the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association. Alcohol use disorder is categorized as mild, moderate, or severe. And this is important because between 9 to 20% of college students meet criteria for an alcohol use disorder. In the DSM, there's this big, long checklist of criteria for diagnosis, but I think it's a lot easier to think of it this way. And basically, just think of the 3 C's: control, compulsion, and consequences. For control, out of control use. Are you drinking more than you intended? Compulsion. Are you spending a lot of time, money, or thought to obtain, use, and or recover from alcohol? And then consequences. Have you had any legal, social, financial, or academic consequences because of your drinking? If you said yes to any of these questions, your drinking may be a cause for concern. But there is help available, and it's really important to remember that alcohol use disorder is a medical disorder. It's not a character flaw. So how do we treat alcohol use disorder? Well, it can involve medical detoxification, therapy, and medication, and any combination of those. The purpose of medical detoxification is to help someone get to an alcohol-free state and manage symptoms of withdrawal. It usually involves 5 to 14 days of treatment, and there are effective medications that help with this process and prevent the dangerous symptoms of withdrawal that can sometimes be deadly, and we talked about earlier. Psychosocial interventions include individual alcohol counseling and help groups like Alcoholics Anonymous or AA, and there are medications that may be used to help maintain sobriety. 2 medications, naltrexone and acamprosate, are rated grade A by the U.S. Preventative Services Task Force, meaning that there's a lot of evidence to say that they're beneficial. A combination of psychosocial interventions, medication, and social services is the most effective treatment. So if you want more information on your drinking, Wayne State has eCheckup to Go or eChug, and this is a brief, confidential tool that provides information on your individual drinking pattern, your risk patterns, your aspirations and goals, and it provides helpful resources at Wayne State and in your community. and you can take it an unlimited number of times to track your alcohol use. If you're looking for resources for alcohol use, there are several options for you. If you have a trusted doctor, you can talk to your primary care physician and they can assess your use, answer your questions, or refer you if needed. Again, here's the Wayne State CAPS information. It's free and confidential. It's a great resource for you. And I understand you may be hesitant because it's associated with school, but your information is confidential and it's not tied to your academic record at all. And they don't break confidentiality unless they're worried about you harming yourself or someone else. And CAPS does have therapists who specialize in substance use, and they can refer you if you need services that they can't provide. And although it's not associated with the school, AA, or Alcoholics Anonymous of Southeast Michigan, is a great resource. They have tons of in-person and Zoom meetings. If you go to their website, at the very top, there are some big letters that are links for their in-person and Zoom meetings. And there's an in-person meeting PDF that's revised and updated often. They're listed by the day of the week and broken up by city and the type of group. They have a variety of different groups like women's only, LGBTQ, young people groups. And I also just want to say that AA is great for a lot of people, but it's not for everyone. And I don't want you to think that that's your only option. A lot of people are very successful with individual therapy. And then here listed is the Substance Abuse and Mental Health Services Administration Helpline. This is a 24-hour-a-day, 365-day-a-year information service. They have English and Spanish. And this is for individuals and family members who are facing mental or substance use disorders. The service provides referrals to local treatment facilities, support groups, and community-based organizations. It's confidential. They just ask that you provide a zip code so that they can get you the local resources based on your zip code. And here is the NIAAA Alcohol Treatment Navigator. This is from the National Institute of Alcohol Abuse and Alcoholism. And if you go to this website, what you can do is you can put in your zip code and it gives you a ton of different programs and you can filter them by type of program, type of insurance they accept, if they provide payment assistance. And then it also gives you different advice for questions that you can ask to find quality care and what to look out for to get quality care when you're actually looking at programs. So overall, it's just a really great resource. And now here is the contact information for the Campus Health Center. We always want you to know that we're here for you. Give us a like or a follow on these social media websites. We post a lot of different information on there and information about future programs like this one. And then here are my sources. Remember that the numbers correspond. So if there's anything that you wanted more information on, go ahead and use my sources. And thank you so much for attending this presentation.